In almost every country in the world, minorities and indigenous peoples suffer greater ill health and receive poorer quality of care than the rest of the population. They die younger, face higher rates of disease, and struggle more to access health services. More often than not, ill health and poor healthcare is a consequence of poverty and discrimination. Minority Rights Group International's 2013 flagship report, State of the World's Minorities and Indigenous Peoples, presents a global picture of the health issues experienced by minorities and indigenous communities.
MRG knows all too well through our work that minority and indigenous communities often are marginalized from all aspects of life in their countries. And so we felt it was important to bring a minorities and indigenous perspective to the right to health.
In Guatemala, indigenous children experience 20% higher malnutrition than Ladino children. In Europe, Roma communities have less access to vaccines and have higher infant mortality rates and child malnutrition. In Tanzania, national HIV/AIDS prevention campaigns were issued only in the dominant language of Swahili. Antiretrovirals, although free, were not easily accessible in districts where pastoralists predominantly live. The report found that the numbers of women dying in childbirth are generally much higher among indigenous and minority communities, particularly those in remote areas. Minority and indigenous children are also more likely to die from malnutrition or preventable diseases at an early age.
Women at risk who may be in need of delivering their babies in hospitals may feel prevented from doing so because they feel that the environments will not be particularly receptive or welcoming to them. And of course, this adds to the risk that they may be facing.
The report also highlights grassroots initiatives to help minorities and indigenous communities speak out for their rights and provide them with essential, life-saving healthcare. As the United Nations debates new global development goals for beyond 2015 to succeed the current Millennium Development Goals, our report makes key recommendations for ensuring that no one gets left behind.
One of the major difficulties we had in writing this report and doing this research was the lack of data on this subject. So you find it very difficult to get ethnically or religiously disaggregated data, and new and recent data is even more difficult to get.
Minority Rights Group International believes that everyone, regardless of their ethnic, religious, linguistic or cultural background, should have the right to access appropriate care and to lead healthy lives. The right to health is the most fundamental right. It is, after all, the right to survive. You can support our work by making a donation, subscribing to our publications, or signing up to our e-bulletin on our website at www.minorityrights.org. You can also get the latest updates by following us on Twitter and Facebook. Visit the Minority Voices newsroom at www.minorityvoices.org to read stories and watch videos from our partners around the world.